Welcome to ETHIOPIan, Ethiopia's multi-tenant electronic medical record platform. In this short guide, we will be exploring how to admit patients and manage the inpatient platform. First, we go on our menu to the admissions button. Here we can see the inpatient matrix, how many beds we have, how many admitted patients, how many free beds, and the percentage of the bed occupancy. We can also see the occupancy by ward and see what availability we have. Then we go to the ward section and we can choose which ward we want to view. For example, if we choose this word, we can then evaluate the admissions based on that word. We can also select different word. First, what we do is we add our patient at the bottom right. We search for our patient by putting in either the health ID or the name of the patient. Once we get the patient that we want to admit, we click on the patient and we will find the button Admit Patient. We click on Admit a Patient and we will get the admission request form. Here in the admission request form, we can put in why this patient requires admission by putting in the major complaint. Then we can choose the name of the doctor, the name of the emergency doctor, if he has one, what payment mode he's using, and then which bed. Here we see empty beds, so we can assign him the empty beds and click Admit. Here we will find the notification that the patient has been successfully admitted. When we go into the admitted section, we will be able to see our patient here. So it has been admitted today. If a patient is ready to be discharged, we can see the list here. If they are already discharged, we can see them here. There is other options for admitted patients. By clicking the action button, we will find an interward transfer. If we want to transfer the patient to another bed in another location for another service, there is a bed swap option, which is to change maybe from bed 3 to bed 4. We can assign a new bed or the option to discharge. We also have an option to switch wards for our own view, which ward we want to view here. We can also go back to the list of wards here. Once a patient is discharged, we can see the discharge summary and provide a gate pass for the patient to go out of the hospital, ensuring all bills are settled. Beds can also be configured. Here in the settings section, we will find an option here that says bed management. we can click on the bed management and be able to review all the beds that we have available. On the ward allocation, we can look at these different wards and edit by providing additional number of beds, and we can edit those numbers to input more beds. We also have bed type options here that we can configure for every institution, as well as bed tags to label them and code them for our management. In addition, here in the settings section, if we go to billing admin, we will be able to assign a billing deposit for our patients. And if we search for a patient, as you know, every patient that is admitted needs to put in a certain amount of deposit to start treatment. So here we add new deposit. The deposit type is cash. Put in cash, we put in the amount, for example, 5 or 10,000. Then we can call it first deposit and save the amount. Here, deposit has been created successfully, and we will see the deposit amount for the patient here. On the menu section, we have the option to apply deposit to bill, edit deposit, or delete deposit. So if the patient has pending bills, then we can pay those bills from the deposit. Therefore, these are the different options that we find in the admissions portal of the ETHIOPIAN to manage inpatients. Thank you very much.